Good morning, everyone. Thank you for joining PHCA for today's webinar entitled Winning at Social Media. My name is Abby Foster. I'm the Director of Marketing and Member Services at Pennsylvania Healthcare Association. Before we get started, I have a few housekeeping items to cover. This webinar will be recorded and made available on PHCA's website following the live presentation. The webinar has been approved for 1 continuing education credit for administrators with skilled assisted living and personal care. Certificates will be emailed before the end of the day. All attendees will be in listen-only mode. Throughout the presentation, please feel free to submit questions via your questions pane on the right-hand side of your screen, and our presenter will address them at the end of the presentation. Social media has become an integral part of our daily lives. Today you will learn how to interact with current residents and families, as well as reach potential consumers. This webinar gives an overview of the role that social media could play in your center or community's marketing and communication strategy. Find out the latest trends on what social media channels consumers are using and why, and how those trends could benefit your organization. The learning objectives of today's webinar is to understand the various social media channels currently popular among consumers and how to use them as a business, to develop a social media plan as part of a community's larger marketing and communication strategy, and to review privacy laws, company policies, and staffing training practices to include social media in order to protect residents and mitigate risk to your company. Our presenter today is Rachel Reeves, Director of Communications for the National Center for Assisted Living, where she develops and implements strategic communication plans to engage members of NCAL, the media, and the public. Thank you, Rachel, for being here with us today to share your expertise. We can now begin the live presentation.
Well, thank you, Abby, and I'm so excited to be able to talk to you all here in Pennsylvania. I'm calling from DC, and just really excited that we're getting to talk about social media nationwide, specifically for our profession. I think there's a lot of exciting opportunities, even though I think some of us and the people I spoke with around the country kind of feel a little hesitant to dive into social media as a long-term care business. But we're going to talk about some ways to maybe think about it and approach it, and hopefully kind of reduce any sort of wariness that maybe you have had about social media, but also just make sure that you're using it in a way that's going to be beneficial to your residents and your patients and their family members, as well as yourself. So today's presentation is called #Winning at Social Media. I'm sure maybe some of you remember when Charlie Sheen kind of went off the rails a little bit and started saying that he's a winner, he wins and everything. And so that started a trend on social media with #winning. So this is just kind of a play on that. But just to kind of go over what we're going to talk about today, we kind of have 2 parts to this presentation, and we've got only an hour, so I do want to kind of keep it moving a little bit. But our first part, we're really going to go through social media, kind of some 101, what are the channels, and then who are using those channels among consumers, how popular are they? And then we're going to focus specifically on long-term care. How could residents and families be using social media, and how can some of your staff members be using it on or off the clock? And then maybe where does your facility or your company fit in? And then part 2 is going to kind of really expand on that. Where does your company fit in terms of how could you start to use social media as a business? Why should you do it? How could you maybe implement a plan? What are some potential pitfalls that you want to be wary of? And kind of ways that you can make sure that you're being effective in using social media with specific posting tips. And lastly, with any good communications plan, you want to make sure that you're analyzing your success, and social media offers a variety of tools to measure how you're doing. So just to kind of get started, we're going to just go through social media and really kind of get into what exactly it is. And I think most of us are pretty well aware that, you know, it's different from your normal online websites where maybe you're just going and looking for information. Social media allows us to actually share content and communicate with other people online. So we can connect and collaborate. And some of these ways that we use social media is maybe through a blog where we'll, you know, almost use it as a diary, but then people can comment. Or maybe we could do an audio recording and do a podcast and share some stories. And again, people could share that with other people that they know. Obviously, we've got some very popular social media channels out there. And I hope all of you are donut fans, because this is one of my favorite pictures, kind of explaining social media through the eyes of donuts. So if you're unfamiliar with specific channels, here's where you can kind of go through and get a sense of, if you're on Twitter, I'm eating a hashtag donut. If you're on Facebook, you may like donuts. There's a specific page. You could follow donuts. On Foursquare, which is kind of a location sort of social media application, you could say, this is where I eat donuts at your favorite donut place. Instagram, you can post a cute photo of donuts with some filters. YouTube, you could take a video. LinkedIn, you could talk about your professional skills in donut eating. Pinterest, you could say, I really like this donut recipe. I'm going to learn how to make it at home. Last.fm is for online radio stations, so you could say, now listening to a song called Donuts. And Google+, the joke with Google+ is that only Google employees use Google+, so that's where it's, I'm a Google employee who eats donuts. So, but we're going to go through each one of these social media channels and kind of skip over some of the channels listed here on this picture and just kind of go through the major ones. So we're first going to start with Twitter. Twitter is obviously kind of a micro-blogging social media channel where you can only use 140 characters per a tweet. But that tweet could contain text, it could contain photos and videos. If you ever see a tweet and you want to reply to it, you can just hit a reply button real easily. Or you could say, I really like that tweet and I want to share it with other people, so you just retweet it. Or if you just really like it, you can favorite a tweet. And the most popular Twitter post of all time is Ellen DeGeneres' post from the Oscars, where all of the stars took a selfie together. That has about 3.5 million retweets and 2 million favorites. Facebook, I'm sure most of you are on Facebook. It's the most popular social media channel there is out there. You can really do pretty much anything on Facebook now. They have expanded it from when it first started. When it first started, it was only available to specific Ivy League colleges, and then it continued to expand to other colleges around the country. Now it's available all around the world and has over 1 billion users. You can connect with specific family and friends with friend requests, and then you can post updates to those friends. You can share photos and videos. You can add some really interesting things to your profile page if you want to build out information about yourself. You can follow groups and events, and so this is where maybe as a business you could think about whether or not you want to have a Facebook page that people could follow you. You can instantly chat with people on Facebook. You can play games and applications, and as I just mentioned, you can connect with businesses. And actually, celebrities are kind of the most followed people on Facebook. The most followed Facebook page is soccer star Cristiano Ronaldo from Portugal, and they just won the Euro Cup. And so that just kind of shows the global impact that Facebook has, that an international soccer star is the most followed person on Facebook. Google+, again, kind of the joke is that only Google employees use Google+. It's kind of built as a competition to Facebook, but it hasn't gained the steam that Facebook has. But it kind of does a lot of the same things that Facebook has with posting photos and status updates and articles and everything else you want to do. The main difference with Google+ is that they have what they call circles, where you can build different kind of sort of groups. So let's say like you want to have just a circle of your family members and then a circle of your high school friends and other different sort of groups that you want to build. You can post things only specifically to those circles. You can kind of segment your audience a little bit. They also have things called Hangouts, where you can video chat. And if you do Hangouts on air, that makes them publicly viewable. So you could kind of broadcast to the world at any time versus only broadcasting to maybe your circles. And then instead of liking a post, they have what they call plus oneing. So just to show how popular Google+ is becoming, you have people like President Obama who use Hangouts on air to have kind of live town hall events almost, where he'll answer questions from people around the country on related issues that he's talking about. Yelp is becoming a very, very popular community-driven review site. We include this because it definitely has implications for the long-term care profession. It's something that I think maybe some of you may use in terms of finding restaurants or finding businesses for specific help that you need, and you're trying to get a sense of what company to use. Or you could find something very immediate in your area if you're walking around and not sure where to go. But it has kind of started to fold in more healthcare-related folks. So what you do on Yelp is, in any business that you find, anybody could post a review or just rate the business out of 5 stars. And then they can also add comments. So a lot of people will, some people share very little about the business. Some people will share their entire experience from when they sat down on a restaurant to when they left. But again, I think with the increasing focus on healthcare, it's really important to be thinking about this from a business standpoint for your skilled nursing or assisted living community. Because one of the things that Yelp did last year, actually around this time last year, is that they partnered with a group called ProPublica to actually add specific data to business profiles related to Medicare data. So here's kind of a screenshot of what you could see on potentially your business's Yelp page. If someone finds your skilled nursing facility, they could also see kind of in the corner of the page some of your Medicare data, and that includes your number of beds, your fines paid, any deficiencies, and any payment suspensions. So if you haven't checked out Yelp yet for your business, I would very much encourage you to do so. Instagram is another social media channel that's really gaining some steam when it comes to younger generation folks. It's a photo sharing mobile application. Basically, you can take a photo and then you can add these kind of unique filters to it to make it look very artsy. And from Instagram, you can also post straight to Facebook, straight to Twitter, straight to Flickr. They allow you to connect your different accounts, so you could post it all at once. You could also set your specific location with a photo, so if anyone's at your facility and they take a picture and they start to post it to Instagram, they could tag your facility while they take that photo. And then obviously with a lot of these social media accounts, you can make your Instagram public or private, so you have to decide whether you want people to follow you. Anyone can follow you, or if you only want to accept requests if people want to follow you. And one of the most popular photos on Instagram ever is among the Kardashian clan. It is Kendall Jenner, who posted this photo about a year ago. And that just shows kind of, again, the younger generation that really tends to be on Instagram. On YouTube, that's where obviously you can find a lot of videos. People can find videos and subscribe to specific channels, which are basically, channels is just another way of saying an account. So let's say you like one person and a lot of the videos that they post, you can follow their channel. You can upload a video very easily. You can do it from your phone. You can do it from your computer. And then with any video you find, you can like, dislike, and comment it. And then if you find kind of random videos that you all really like, you can add those to any playlist that maybe you want to customize. So one of the biggest videos, most watched videos of all time, is the video from Psy, which is the song Gangnam Style, which has 2.4 billion views. A lot of views for that song. LinkedIn is another social media site, and this time what it really focuses on is professional networks. So this is where if you, as a long-term care professional, you could be on LinkedIn and post your resume. You could post anything related to skills that you have. And then you can also find other people, other colleagues. You can find friends on LinkedIn too. A lot of people who are friends connect on LinkedIn as well. But it really is more of a professional site, so if you're looking for jobs or if you're looking for ways to kind of be more productive at work or inspiration or things like that, a lot of people look to LinkedIn. For instance, one of the most popular articles on LinkedIn from a previous year was actually about how successful people stay calm. And so you can see in comparison to Facebook, Instagram, everything else, you know, we're more focused on celebrities. Here, LinkedIn is really uniquely focused on professional advancement and ways to be successful in the workplace. Pinterest is another social media site that is gaining a lot of traction, specifically among women. It is really kind of a way that you can do social bookmarking. So if you see anything online that you really like that you kind of want to save for another time, you can use Pinterest as like a visual bookmark, and you can save it with a photo specifically, so it's kind of a reminder of what that thing is online that you wanted to make a note of. If you want to save them, it's known as a pin, which is that way of bookmarking. And then if you want to kind of form your collections together, they're known as pin boards. So let's say you have a number of recipes that you want to save. You could create specifically a recipe pin board to save all your pins in that one place. Or if you have activity ideas for your long-term care facility, you could have an activities pin board. And you can see what other people are saving or pinning on Pinterest. And if you like that, you can like their pin or you can repin it as well. So one of the cute ideas that we saw on Pinterest was, this was another very popular pin of grandmas as flower girls. So here's just a picture that people pin as like, oh, what a neat idea. And they could save it to a specific pin if they've got a category set up. Another social media channel that's really fastly emerging, and we're going to talk about later specifically when it comes to staff, is Snapchat. This is a photo and video messaging app. And what it does is that whenever someone takes a photo or a video, they can send it to anyone who's following them on Snapchat. They could send it to a specific person, or they could send it to multiple people. And then when that other person opens up their Snapchat, they could see what that person sent them. But when they open the photo, it's only going to last for about 1 to 10 seconds before it disappears. And Snapchat says that their app, all of their photos disappear permanently. They do not save them. They're gone. And so one of the ways that people could say, well, I actually really like that photo and I want to save it, is that you can take a screenshot of a snap, is what they call them. And then the person on the other end who sent the photo will receive an alert saying that so-and-so took a screenshot of your photo and it's now saved. So that way someone has a heads up that their snap is not gone forever, someone took a screenshot of it. The other thing that works with Snapchat is that they have what they call your story. So this is a 24-hour collection of your photos or videos that you can broadcast to the world or just your followers. And so that's where a lot of celebrities are starting to use Snapchat, and they can just post it to their story, and that way anyone can follow them and they can see any photos that they post throughout the day. Now this isn't a specific social media channel, but just a facet of social media. Obviously this presentation is called #winning at social media, and I just want to explain hashtags for a second to talk about how they really are used in social media and how they've become such a trend. It kind of really started out first with Twitter, and then other social media sites have added hashtags to their repertoire. But it really allows people to kind of tag whatever they're posting, maybe with a specific theme or content. So let's say, on HCA InCal's Twitter, we want to post something about Medicare. We may put #Medicare. And that way, anytime anybody clicks on Medicare in our tweet, they can see every other tweet that the world has put out about Medicare. So it kind of helps us push our message into the Medicare ether to talk about specific issues or that. Now, some other people will use hashtags kind of as a cute little side note instead of actually conscientious of a specific theme or word they want to use. So it's just another way that people are kind of making social media a little bit more fun instead of just specifically categorizing things per se. So that's kind of a social media one-on-one. I think now we're going to get into now who's actually using social media and how many people are using them and kind of in what sort of way. I think what's really fascinating is just the amount of growth in social media in just the past 2 or 3 years. When you look at internet users in America, 75% of them are now active on social media. So it's become pretty much the practice that if you're online, you're on social media. Now, if we look specifically at online adults who are maybe potentially our target audience, we saw such a dramatic increase in only a year that online adults are using 2 or more social media sites. So you're not just on Facebook, you're probably on something else as well. And that's where, those are really helpful to keep in mind as you think about using social media as a business. If we kind of break it down into age demographics, you can see that there's really a tremendous growth in the 65 or older population when it comes to social media. You can see they are still like the least likely to be on social media, but their growth from 2008 has been tremendous, that it's really something to sit up and pay attention to nowadays. Obviously, your 18 to 29-year-olds are your most popular social media users, but when it comes to, again, looking at our target audiences, seeing how frequently they're using social media is really helpful. If we look at sheer numbers, obviously Facebook is the most popular social media site there is. Twitter and Google Plus are behind with another 1 billion users themselves, YouTube as well. And obviously your smaller sites are Yelp and Instagram and Pinterest, but I think it's important to also pay attention to how fast they're growing and how active people are on these sites. Because you can see, this is a very sharp image, but you can kind of see that just because you're on the social media site doesn't mean that you're an active user. And I think they define active user by somebody who uses the account at least 1 or 2 times a month. So on Facebook, you see probably the most active users versus Pinterest, where there's not as many people on it, and there's not a lot of many active users. So it's something to keep in mind as well in terms of figuring out who you should be reaching out to on social media. And then again, among active users, you want to be looking at what are the fastest growing channels. Facebook is obviously the most popular, but its active users have actually gone down. And when you look at other sites like Pinterest or Instagram, there is definitely a growth in the number of people joining these sites and the number of active users. So specifically, if we look at residents and families in long-term care, how could they be using social media? Obviously, there are some pretty straightforward ways where, maybe our residents want to be connecting with old friends and family. Maybe they don't live close to their family, and so social media offers a way for them to kind of follow their family members online and see what's going on. They could also be using it to connect with your facility. They could be looking up information about your facility or posting on online reviews, which we're going to talk about. And then another way that a lot of consumers are increasingly using social media, and especially as we have found out this past week, is citizen journalism, which is something we'll talk about here in a second as well. So when it comes to ways that you could kind of increase your customer experience at your long-term care facility in terms of social media is maybe you want to offer free Wi-Fi, or maybe you want to offer computer stations or laptops and tablets. I'm sure this is pretty common for a lot of you. And then on a lot of computers, I've heard facilities offer Skype, and that is actually shown to be a cost saver versus long distance calls. So that way residents can actually video chat with people, with family members, versus making those long distance calls, which cost a lot more money. And Skype is free. And then obviously, it's another way to connect to the local community around you. But we've also mentioned that residents and families could be using social media to post online reviews. And this is where we're going to talk about Yelp a little bit more. And Facebook offers online reviews, and so does Google Plus. But this is a screenshot of a skilled nursing facility profile on Yelp. And I've kind of blacked out some of the details just so we're not giving away specifically what facility or where and the individuals who have posted things. But again, you can see on the middle right-hand side what we talked about earlier in terms of ProPublica offering Medicare data on a skilled nursing facility. So right there on your page, you can see the things we talked about, the number of beds, the number of fines paid, deficiencies, payment suspensions. Up at the top, you can see the amount of reviews they have received and what that review breakdown is in terms of they've got 3.5 out of 5 stars. Obviously, then at the top, anybody who comes to that page could write a review, they could add a photo, they could share this, they could bookmark this. This facility has done a good job in adding photos to their profile. It adds some color, it adds some more information. People like to browse through photos on Yelp. And then you can see down at the very bottom that someone started to write a review. It's cut off because of the page, but you can see that they said, I just put my mom in there today. She is 97 and has been in a number of rehabs before. She was here at this facility a year ago. I'm very happy with the care that she received last time in the facility. Many truly wonderful people are working here. So that just goes to show that, online reviews are something that people are using more commonly, and that it could be a way to, people are telling a story about your facility. If you're not aware of it, people can be creating these Yelp profiles even without you. So it's something that you definitely want to be conscious of and making sure that you're being proactive with. I think one of the scary things about being social media and allowing these sort of comments is that obviously you're going to be opening yourself up to negative comments. But social media is a two-way conversation. That's what it is, and there's always going to be risk there. It's always a matter of just how you handle it. So here's an example of a negative review on TripAdvisor. I think this is a hotel specifically. And you can see that someone posted a pretty bad review. They were very unhappy, but the management team responded back. So I kind of want to walk through a little bit some tips to keep in mind in terms of responding to negative comments should you get any. First and foremost, stay calm. It does you no good to get heated up about any negative comments. And I think you will find that online people sometimes are somewhat on the extremes. They're either really happy or they're really upset. There aren't a lot of mediocre comments online. So it's important to stay calm. Obviously, negative comments can really get under your skin. But next you want to do is respond privately. Obviously, especially in our healthcare world, we can't really get into a lot of specific issues about cases or patients. And this is a very, sensitive topic for some people. It's best to talk to them privately and figure out what their situation was. See if there's a way that you can rectify the situation or apologize or let them know what you've done to address the problem. And then just don't be too defensive. You want to see if there are ways to solve it and invite them to return to see the solution. Then you want to respond publicly, and this is what we saw on the last slide, that the management team responded to this negative reviewer. And it's important to mind that this response is not for the person who commented, who made the negative comment. This is for your other would-be customers that are coming to maybe your Yelp page or any other review site and are going to see how you responded. And so you're going to demonstrate that you're on top of your customer service this way. So I want you to kind of think about this after today's webinar and how you would respond to someone who posted this. And this is an actual review that somebody posted on a Yelp page. And just think about if you found this on your Yelp page, how you would respond. But for time purposes, we're going to kind of keep moving today. The other thing that we're seeing on social media more and more is that citizens and consumers are using social media almost as their news site. And so they're being able to take photos, take videos, tweet, whatever they're seeing at a moment's notice. And so I think it's important to keep in mind that, we're obviously aware that some people will put in granny cams or other things like that. Obviously, your staff should always be feeling like you're being recorded at any time, because you can be. Anybody can pull out a cell phone and take video. And what's interesting is that not only are people using social media almost as journalists themselves, but it's where a lot of people are going to find their news. We've seen a dramatic increase in just the past 3 years in the amount of people on social media that use Facebook for their news. And Twitter, we're seeing an increase as well. So it's something that, when people post these sort of citizen journalism posts, that's where a lot of people are also circulating that around, and it becomes news in and of itself. And so it's becoming more relevant. Now I want to talk about specifically how your staff members could be using social media. When we look at kind of the age groups that are in long-term care, we can see there's a lot of employees in the 25 to 34 year range. I think we've got a growing number of 20 to 24-year-olds. And then obviously we've got a lot still in 45 to 54. These are age groups that are really relevant in terms of social media. So if we're talking about how 75% of internet users are using social media, you can pretty much assume that your employees are using it personally. Whether they're on Facebook, on Twitter, on Instagram, they're using it. What does that mean for you? If staff are talking about the workplace, they do have rights when it comes to talking about that on social media. The National Labor Relations Act actually protects the rights of employees to act together to address conditions at work with or without a union. And this extends to certain work-related conversations conducted on social media. So you cannot really prohibit them from being on social media or talking about work on social media per se. There are specific things that obviously you can put into policy, but like for instance, they can talk about wages or working conditions on social media. So I would familiarize yourself with this act if you're not already. There are some tools out there to kind of help you get more familiar with it from the National Labor Relations Board. But at the same time, obviously, we want to be protecting the rights of our residents, protecting their privacy. And one of those areas is HIPAA. We want staff to not be sharing information about residents or patients online on social media. And so we've seen a number of headlines over the past couple years now of staff members who are posting photos or videos of residents and patients on social media. And this goes directly against what HIPAA talks about and other privacy laws probably in the state of Pennsylvania. So this is something that we certainly want to make sure that we're on top of, that we're training staff members, that we're talking about this issue, that they're aware of what the proper procedures are. So HCA and Cal has put together kind of a number of tools, and I'm going to direct them to those to you in a second. But just kind of an overview of some of the things you really need to be thinking about when it comes to your staff using social media on or off the clock. It's really important that you have policies in place. You may have policies already, but you need to make sure that they include social media. And that way that they can protect the residents and the patients, but also the employees in the care center. So this means that you can kind of set a code of conduct that clearly defines what the center expects from its employees when it comes to online behavior. You could even use specific examples of what are do's and don'ts when it comes to social media posting, so that way they can get a clear sense of things that they're allowed to do in social media related to on the clock or not. We've also heard of some companies that decide that there's just a zero cell phone use policy on the floor. So as soon as you clock in and you're on the floor, your cell phone needs to be put away. You can use it in break rooms, but you can't use it on the floor. But I would advise that you talk with your in-house counsel to really figure out what's maybe the best policy that you could put in place. And then it's really important to review and update these policies frequently. Social media changes frequently in and of itself. It's really important that you continue to review your policy to make sure your policy adheres to these things. I mean, for instance, the Snapchat issue, we've seen a lot of stories about Snapchat specifically, and this is a new emerging platform that came about maybe a couple years ago, and it's really taken steam with the younger generation. And so that's where you want to make sure that you're on top of those sort of new platforms that come out so you can change your policy and adhere to that. And then obviously beyond policies, we want to make sure that we're training staff. New employees should be trained on social media during orientation and really made aware of your policy up front. And then again, because social media changes so frequently, and we need to remind our folks time and time again that this is still something they need to be thinking about, your training should be done periodically with current staff as well. So again, HCA and Cal has created some new tools related to this issue, and this link, you can go to our website and download these documents that we have available. We have a social media guidance document and then a best practices document for social media, which kind of goes over some of the best the tips to mitigate your risk that we looked at on the last slide. How does your facility fit into all of this? You know, consumers are using it, your staff are using it. What about you? Well, I think that obviously as we looked at with review sites, with staff posting pictures, anything like that, what happens in your facility could go very public. And with social media, things can go viral, which really just means that people could share it and it gets widespread. And that obviously would affect your reputation or brand. I mean, it's all about what image do you want to put out there to your residents, to potential residents, to their family members. And I think there's a ripple effect. You know, I think we continue to see that long-term care is vastly misunderstood. I think there are a lot of good stories that we could be putting out there on social media, and that really could help, you know, help people understand us a lot more. Obviously, any negative social media posts that happen to you, that could also really hurt you as a business. And we've seen before that you could be held responsible. There are now actually cases brought against long-term care facilities if they feel like the company was negligent in training staff members on the proper use of social media. Now, I hope I haven't scared you all away from using social media, but I do want to make sure that you really understand some of the things that people are using it for and how you could be using it to really your advantage as a company or a business. So I think you have like a really big opportunity to reach some people, and it really just going to depend on who you're trying to reach, and we're going to talk about that in a little bit. If we look at specific social media platforms, for instance, Twitter, you'll see that there are some really good stats out there in terms of, you know, businesses. If Twitter businesses are followed, they actually will be bought from, as we see from over a third of Twitter users will buy from brands that they follow. On Facebook, nearly half of online adults use Facebook, and that's 31% of all seniors. I think what's really interesting is that Facebook is obviously a very active site, and people really engage with it daily. With Google+, anyone who's on Google+ as a brand, about half of their customers will engage with that and find that, you know, their engagement is positive. And then on Yelp, we see that 90% of Yelp users say that positive reviews really impact their buying choices. So that's where, again, if you're not on Yelp or you're not aware of the online reviews on Yelp, you really want to be conscious of that, because Yelp users are really using those reviews to help decide what they're going to do. If we look at Instagram, the fastest growing demographic is 55 to 64-year-olds. This is obviously a target audience potentially for you all, as they may be family members of loved ones looking for long-term care and just thinking about, is there a way that I could reach them? YouTube is just a very, very popular video site. Obviously, 6 billion hours of videos watched per month. Is that an opportunity for you? With LinkedIn, I know workforce is a growing challenge for long-term care. Is LinkedIn potentially something you want to use to connect with students or recent college graduates to see if they want to work at your facility? Pinterest, I think we know that majority of our residents are females. A lot of family decision makers are females. So using Pinterest could be a way to reach that specific target audience when it comes to finding long-term care or people who are interested in long-term care. And why do it in general? You know, today's world offers and encourages multiple ways to communicate. I think what's really interesting about social media and today's technology is that people aren't just looking for information or products and services, but looking for people like them, and they're looking for experiences. And social media allows them to find those people and to find, you know, what was their experience with a product or a business. And people are really taking those to heart and really making them part of their decision-making process. So obviously, again, with online reviews and other social media posts, there may be a conversation going on about you online. And do you want to know what that conversation is, or do you just want to let the chips fall? So I really like this quote from Eric Qualman. He's actually an author of a book called Socialnomics. And he's not, you know, a big author or anything like that, but I really think he hits the nail on the head with, we don't have a choice on whether we do social media. The question is how well we do it, because social media is here, and it's here to stay. So how can you start to use this as a business? Really, the important part is to understand what its purpose is and to really start to set forth a plan as part of your larger marketing communications plan. It's important to keep in mind that social media is not a destination. It is definitely a journey, and since it's changing so rapidly, it is a very long, ongoing journey where you need to stay up and educate yourself constantly. And it's a set of tools. It's not going to be the only thing that you should be using that's going to be part of your arsenal when it comes to marketing and communications. You want it to be reflective of your company or community's image. Take a look at your mission statement. How can it be a part and support your mission statement? And then obviously you want to be using it to your advantage. Think of ways that you could demonstrate the good work that your company or community does with maybe you highlight the residents that are in your community, or you highlight unique ways that you're innovating care or connecting with the local community, things that people wouldn't think that you're doing and you're doing consistently. And then maybe you want to offer yourself as like consumer information for people who don't understand long-term care. You could put out general information that's good for the general public. When it comes to figuring out how you could start to use social media and how to use it for your marketing communications, you really want to assess specifically, the size of your facility or your company. How many staff members can I have working on this? And then also how many people could I potentially reach? Am I just targeting my current residents and family members who are engaged with the community, or am I trying to reach a larger set of people, potential customers, or even the general public? And then you want to figure out, what do you want to accomplish? Do you have specific goals as a company that you're trying to reach? And then another thing that we often push out there when it comes to social media is that we want to advocate for the profession versus always just marketing to potential consumers. So it could be a way that you engage with maybe your local elected officials, maybe a member of Congress, and really get them engaged with your long-term care facility. I would say that, if you're really jumping into this for the first time, the most important thing you can do is just Google your company's or your facility's name. If you haven't ever Googled yourself before, I've done this before at other speaking engagements, and people were shocked by the things that they found online, the incorrect information, or the variation of their name of their building, because people will set up their own sort of profiles for you based on whatever they're doing online, and versus you setting it up yourself. So they don't know specifically the right verbiage of your name, or they don't know exactly what all you provide. They're just providing the little limited information that they're aware of. And so if you haven't yet, I would encourage you to go ahead and Google yourself. Go ahead and search for your business profile on Yelp or on Facebook. And one thing you can easily do is just claim your business. And I'm going to show you in a second how you can do that on Google+. But it is just a simple way to go ahead and start building out your profile, just putting in basic information, so that way you can be sure that that basic information is correct versus someone else putting incorrect information out there. So here's a screenshot of HCA InCal's Google search. So I search for HCA, and this is what comes up on Google. What Google Plus has done is that it has connected all of its Google products, including Google Search. And Google Search is one of the biggest websites out there today. I think most of us, some of us will have it as like even our home page to just go straight to Google and find anything we're looking for on the web. So that's where Google Plus is actually a very relevant social media platform, because here on the right-hand side, you can see there's a picture, there's a map, and then there's a kind of this initial blurb of the American Healthcare Association with our address, our phone number, and our hours. You can see down at the bottom it says, are you the business owner? And then also on the right you can see that it says write a review. So that's where this is actually kind of a little Google Plus area on the Google search engine. So this is our Google Plus profile, kind of specifically whittled down to include on Google search. And that's where you want to build out your business profile, because that's what people are going to see when maybe they potentially search for your building. Obviously, our website comes up on the left-hand side and Wikipedia comes up below that. But this can give people a sense of immediately tying them to Google+, or maybe giving them an immediate sense of your business in terms of, if we did have any reviews, people could see that immediately, because right now it just says be the first to review. But if there were reviews from other people, you would see a little bit from each of those down here on the Google search page. So that's where I encourage you again to Google yourself, see what's coming up, and see if you want to add any photos of your business or basic information, so that way when people search for you, they see what you want them to see. Next, it's important to make sure that when you jump into social media that you have a plan. Do not just join a site because you think it's the most popular or you're most familiar with it. It's pretty easy to learn a lot of these social media sites, and you just want to make sure that you're reaching the audience that you want to reach. So that's where we went through a lot of that data earlier, just to get you more familiar with and maybe help identify what audience you want to reach, therefore which platform you should be on. Obviously, you want to identify who will manage your social media sites. Definitely as part of your social media policy, it should include any dedicated staff that you're going to have work on social media. Only they should have access to those passwords. Only they should have the ability to post things. You want to explicitly point that out and make sure that those staff members are properly trained on social media. So that way, again, you're not going to run into any hiccups when it comes to HIPAA violations or anything inappropriate that you don't want posted on your social media site. You can set specific, measurable, attainable, realistic, or time-bound goals that are SMART goals to make sure that you're meeting, you've got that as part of your plan. And then obviously, like with those staff members, you're going to want to brainstorm possible posts and stories that are in line with whatever your goals are in social media. We have found it really helpful to have a schedule because it's really easy to get sidetracked and focus in on everyday work. If you kind of have an idea of what those posts are that you want to make, then you can schedule those out and make sure that you're doing it. Facebook, I think they really encourage you to post once a day if you can, because that's what's going to help your page continue to be promoted to your followers and make sure it shows up on their feed. And then obviously you want to be monitoring your progress with any plan. It's important to make sure that you're meeting those goals that you have set forth. And then another important part is to check your reviews, to respond appropriately, as we talked about earlier, and just make sure that you're monitoring any conversations going on about you versus just always planning out what posts you should be putting out there. It's important to keep in mind that social media is, a lot of these sites are absolutely free to join. You can easily set up an account, but it is going to be an investment. It takes time, it takes people, it takes resources. You're going to have to really kind of work at this as part of a larger strategy. But I think there can be a lot of reward in doing that. So that's where you just want to evaluate. It doesn't make good business sense for me to be on social media. How can we balance it with our workload as it is? And just make sure that you're, again, aligning it with your larger goals. Now, we've talked about some of the issues with risk. Obviously, we want to make sure that, again, we're ensuring the privacy and dignity of our residents, and that we're adhering to HIPAA requirements and other privacy requirements. And that's where, as we talked about earlier, putting it in part of your larger communications plans and privacy policies is just so important. One way you can really ensure that residents are okay with being put on social media is to develop an image or authorization form. I think many of you may do this when it comes to admission. As soon as a resident is admitted to your facility, you have them sign one of these forms saying that they agree that their image could be used in any of your marketing materials. You could easily adjust that form to include social media or online presence. And that way you can make sure that family members and residents are aware of, hey, this is something that we do. We are on social media. If you don't feel comfortable being on social media, please let us know, and we'll make sure that we don't post anything related to your image or anything about you. And again, train your staff. Train as soon as they become new employees, and then train continuously. There is some risk, obviously, when it comes to social media. I know that we're scared of some pitfalls. You know, we've got former Congressman Anthony Weiner, who did some inappropriate tweeting that I think we all recall. And then there are other accounts that maybe didn't do their homework so much when it comes to being on social media and trying to stay relevant. I think we're all quick to try to join whatever the latest trend is. And this is an example of DiGiorno Pizza that used the hashtag #WhyIStayed because they saw it coming across Twitter and they saw it coming a lot. So they thought, oh, that'd be funny if we kind of do a play on that. Well, hashtag #WhyIStayed is actually related to domestic violence and why survivors of domestic violence talk about why they stayed with the person that abused them. And so DiGiorno had to apologize for this because they posted this and didn't realize what it was actually in relation to. So it's important that, you know, with social media that you're doing your homework, that you are keeping up on whatever people are talking about and not just joining something on a whim. But there's obviously a lot of reward. You know, this is an example of a hospital that posted a picture of these two patients that were actually married, and they shared this really, really touching story about how they wanted to stay together while they were in the hospital together, and they just haven't been away from each other before. And I think there are stories like this going on in our facilities all the time. Obviously, you all aren't hospitals, but you do have really unique individuals with unique stories that really could touch a chord with people online and really help them see the great work that you're doing as well. This is another example of a reward. These are actually assisted living residents in a facility in Georgia, and the staff took this little video. It's like 1.5 minutes long, and they're actually dancing to the hip-hop song Watch Me Whip and Nay Nay. And this has 28 million views and over about 3,000 likes and over 600,000 shares. So this is, again, probably something going on in your facility every single day, but you just capture that moment and you post it online. It could really, you know, potentially go viral. We're going to talk about viral in a little bit. So again, some unique opportunities really talk about the work that you're doing or just the everyday moments going on in your facilities. So when it comes to being on social media and using it effectively, I'm just going to offer some tips on ways that you can really maximize being on these platforms. Obviously, social media is a discussion. You know, you don't want to just be talking at people, and you want to find ways that when you're posting things, how are you connecting with folks? You can ask these sort of questions of what are we offering here? Why should they follow us? Can they identify with what we're saying? And just keep in mind that obviously, like social media, you're going to want to connect more as a person. Too promotional is just boring. People don't engage with that. So you can find other ways to engage. Here's an example of a post by Brookdale Senior Living, the large company across the country, just posting a picture of a resident with another staff member and how they did a great job of really connecting it with this resident's specific story. It was her wish of a lifetime to have a professional pianist play at her birthday celebration. And they also did a great job in tagging the specific organization that kind of made this dream come true for this resident. So you can see that on Wish of a Lifetime, they're engaging with Wish of a Lifetime by tagging them in the post and really kind of cross-pollinating when it comes to connecting with other businesses, but also sharing a really personal story of this resident. You want to consider things like asking questions so that way you can get some responses. We've also found that images and multimedia, like video, as we just saw with the dancing residents, really goes far on social media. A lot of them offer specific features. You want to look at those features and see if that could help in actually creating an effective post. And you can encourage sharing. Just really make sure that people are liking it and then sharing it with other friends. So here's an example of a post on our National Assisted Living Week page where we found a story with a great image of a person who goes and trains people on how to fall. We just put in a quote from the story and something about, that person and something personal about them so people could connect to that. And we've, saw that it reached about 4,000 people. When it comes to Twitter, just some specific tips to keep in mind. Images go a long way. While it's hard to keep things at 140 characters, it's also helpful to keep things short and sweet. You get more engagement if you keep it to 100 characters. You also don't want to overdo it with the hashtags. Only 1 or 2 are probably encouraged for a tweet. And when thinking about your audience, a lot of people on Twitter are actually using it on their mobile devices, so cell phones and iPads. And so when you think about the timing of posting something on Twitter, a lot of people are on their mobile devices during their commutes to work, so that may be a good time to post something. Another way to kind of help engage people is to even just ask them to retweet it. That seems to actually increase your engagement. On Facebook, same sort of thing. You want to make sure that you're keeping things pretty short and sweet. Too long posts kind of doesn't get as much engagement. Photos and videos go a long way. And telling stories of people, I think that connecting with people at a human level just really goes a long way on Facebook. Again, timing, you want to be conscientious of when you're posting things. And Facebook has really great insights that you can use on your page to figure out what time you posted something and how much engagement you saw from it. So you can kind of use trial and error to see what are good times of the day for you to post and what days of the week as well. Keep in mind that 75% of the engagement on a post happens in the first 5 hours. Once you post something, after 5 hours, it's probably not going to get a lot more traction after that. And again, like we talked about, connect like a friend, not like a business. Too promotional is boring, and so people want to relate to whatever your post is. On these review sites, you want to make sure, again, that you're just building out a basic profile. It can really boost your search rankings, and also just make sure that that basic information is there for anyone who searches and finds you. You want to encourage customer reviews. If you're working with a patient or a resident or a family member who just expresses such great gratitude for the care that you provided, consider asking them if they'd be willing to post something online on one of your accounts. And obviously you don't want to influence whatever that review is, but just let them know that that's a way that, that could really, help in terms of, saying thank you, I really appreciate that, but, we also have a Yelp page if you want to consider making a review. And then you obviously want to kind of interact with anything else going on Google Events or Google Plus Hangouts. That's going to help promote your profile out there on the web. We're not going to get into this today, and I know we're actually running short on time, but if you did want to make a further investment in any social media, there are options to kind of boost your post or place ads or things like that. So if you are looking for more information about how you can make kind of a very specific investment in terms of boosting things or promoting things, feel free to shoot me an email after this, and I'd be happy to get you some more information. When we talk about going viral, we saw the video with the women dancing. It's important to realize that not everything you post is going to go viral, and it's really not something that we can pinpoint and really say, okay, this is exactly how you do it. But I think the important thing to keep in mind is that when you're posting, to really concentrate on the content, that it's positive, that it's got really specific arousal emotions tied to it, or that it's practically useful. And really accept that your audience is really going to decide what they're going to connect with and share and promote. We saw a couple years ago that one of the things that really went viral was the ALS Ice Bucket Challenge. And I mean, they've raised more money in that 1 year than they have in multiple years combined. And it was because this online campaign really had 4 things going for it. It was unique. It had ingrained shareability, so as soon as you did the Ice Bucket Challenge, you asked someone else to do it as well. It had an entertainment value, so obviously someone dropping a bucket of ice water on their head was really funny. And then it was a part of something bigger. It was for, a good cause. And so when we think about, those sort of things when it comes to going viral, I think those are really good lessons to keep in mind if you're ever looking to really spread the word about something. Lastly, I just want to go over ways that you can analyze your success. Any good social media plan is going to be monitoring their posts and their likes and their followers, and really just making sure that they're meeting those specific goals that they set forth at the beginning. So with any social media, you can follow your views, your clicks, your shares, your comments on any specific post that you put out there. And then generally on your profile pages or accounts, you can follow how many people are following you and whether you're trying to increase those followers, any general feedback you get on your account, any mentions that people make of you just on their own. And again, if you want to make an investment, you can look at organic reach, which is just, you haven't put any money behind it, or paid reach where you have put some money behind it. A lot of these social media channels offer analytic tools right within their sites. You can easily use those. This is an example of a Facebook Insight background where you can see the total likes that people are getting over the course of a certain amount of time. You can export that data if you want to share it with any of your business colleagues. But there are also specific tools that you could go to maybe bring together all of your social media channels like Hootsuite or Sumall. And then you also want to monitor mentions of you. This is kind of your reputation management. So you're not just monitoring your accounts that you have set up, but you're looking for any mentions of you online in general. So if anyone's kind of almost going rogue in a way and talking about your business on any other websites or accounts that you don't have set up, you really want to make sure that you're looking for that information and seeing if there's a way you can respond to it. I would also just encourage you, if there's any crisis that comes up, to think about monitoring brand mentions or sentiment. I think one of the things that we have found is in a crisis, a lot of people turn to like Twitter for immediate updates, that sort of thing. And they'll post things on there as well. That could be a good platform for you to go to in case, for instance, you have any flooding or fires or anything like that. You want to report to family members what's going on. So just final thoughts. I know we're a little bit over time, and I do want to answer questions. Just a reminder that social media is here to stay, and it's something that, again, if you want to be a part of the conversation that's going on about you online, you really should be thinking about ways you can join that conversation on whatever platform you think is most relevant. There are risks, but there are also opportunities. Again, highlighting the great work that you all do every day could really help tell a story about long-term care that I think we don't always see in the press, and it allows you to tell your story straight from yourself, which is really great. I would say the first major thing you've got to do is make sure that you're searching for your business on major social media channels and making sure that you're claiming those businesses and filling out a basic profile at least. And then lastly, as we talked about, just make sure that if you are going to become active on social media, join the channel because it's best for you and your staff and your goals, not just because it's popular. So with that, Abby, I'll open it up to any questions.
Thank you so much, Rachel. These were great tools and insight on managing our online brand, mitigating risk, and promoting the positive stories and good work that you guys do every single day within your facilities and communities. We don't have any questions posed right now, so if you guys do have any questions, if you could use the question pane on the right-hand side of your screen and submit them. We've just about exhausted our time, but we'll leave it open for a minute or two more. Seeing no questions come in, Rachel, you just did such an excellent job that everyone is sufficiently educated on now. So we will be posting this presentation to the PHCA website. Again, to attendees, your certificates will be emailed before the end of today, and everything will be made available on phca.org. Please feel free to share. And Rachel has graciously offered herself as a resource to attendees. I will include her contact information, as well as please feel free to use PHCA, the staff here, Eric Keel in our communications department, as well as myself, if you need assistance setting up a strategy, coming up with parameters, or guidance on employee training. At this time, this concludes our webinar. Thank you again to Rachel for this presentation, and everyone have a good day.